The chair would like to call the Health Committee meeting August 8th, 2024 to order. We have all members present except Member Johnston and Member Knapp, but Member Knapp is on his way. So we do have a quorum. We have consent agenda. Do I have a motion? Motion by Hanson, second by Byrne. Any discussion? Hearing none. All in favor of the consent agenda, say aye.
Aye.
Aye. And any opposed? Okay, that is approved. Do we have any members of the public that have requested to speak?
Chair Shaver, we've had no requests for tonight.
Thank you. So we'll start moving on to departmental matters. Tim Wiley, Nursing Home Administrator, is first up.
Hello, everybody. We enjoyed a good month again in June and captured the statistics in the report for you. One quick point of information is October will be the month that we will be celebrating our 50th year in that building. So we are planning on October 4th from 2:30 to 6:30 to have an open house, hopefully a ribbon cutting with the Chamber of Commerce, and more information will be forthcoming about that event. We hope that you all can make it. I'll be happy to answer any questions related to the report that you might have.
Questions from the committee? Nope. We're doing okay finance-wise, huh?
So far, so good.
Okay. I was not at finance last night, so I don't know what some of the numbers, the final numbers were, so. Do you have them?
So far, year to date, we're showing a net operating income of $132,973
Awesome.
so far.
Thank you. Thank you. Okay. And Mr. Knapp has just entered, so he will be marked as present. Next up is Jason Tabb, Juvenile Detention Superintendent.
Good afternoon. I believe you all have my report. If you have any questions, I'd be more than happy to answer them.
Any questions for Mr. Tabb? Hearing none, thank you.
Thank you.
Next is Alana Strum from Advanced Correctional Healthcare and Diane Hughes, Jail Superintendent.
Good afternoon. Ms. Strum prepared the report with our statistics if you have any questions. And I will add that for the next meeting, Jackie Mathias will be able to attend.
Yeah. Any questions about the report that was included? Okay, thank you. Moving right along. Next is Jessica McKnight, Health Department Administrator.
No items for action tonight, but you have my report and would like to just highlight in the report, Health Promotion submitted some information about our mobile health unit, which has been out to the rural communities. So we're seeing an uptick in the participation as more people are aware of it, but averaging about 10 people. So pretty exciting stuff.
Great. Were you out at the fair? At the McLean County Fair?
The mobile unit was not, but our breastfeeding support is there.
Okay. I couldn't remember. Thank you. Any questions? Go ahead, Mr. Member Byrne.
Chair Schaefer, just to go off of that, I did see you all at the fair and saw a good crowd outside the fair. A lot of I appreciated the very forward message that we were putting forward and the accessories they had available, and I thought it was a great service to members of the county. So kudos to those who are out there. Thanks for doing that.
And another thing just to mention is that the Board of Health has released the RFP for behavioral health services to the community. So if you know providers that might be interested in applying, that's on the Health Department website. So for 2025, calendar year 2025. So anything else? Okay, thank you. Next is, are we done already? All the way to Cassie Taylor, County Administrator. Oh, wait a minute. Do you have that one thing on the, I'm sorry.
I do, yes. In addition, just for information for you all, last night we took a reclassification request for public health nurses to finance committee, so that was approved last night. But just including that in the packet and here for your information.
Thanks. I forgot about that one. Now we can move on to Ms. Taylor.
Thank you, Chair Schaefer. I have no items for action tonight, but I would like to introduce our presentation on CESA. We have Rhonda Flagel from our Metcom 911 Center and Megan Mosier, who works for the Center for Human Services as the Mobile Crisis Unit Director, Supervisor, Manager, all around poobah. So I'll turn it over to both Rhonda and Megan.
Thank you. And we're just gonna sit here tonight, just to go over these quickly. As Cassie introduced us, we also are your Region 2 representatives for CESA. So we've been on this RAC since 2022. And we've attended meetings since then. And also we've attended a couple different forums, most recently a couple months ago in Chicago at the Behavioral Health Hub, where we went over things regarding CESA. Last month, we held a hyper-local meeting in our area for our first responders and our,
Can you explain, the acronym CESA, what that stands for? Is it on?
it's on a slide. It's okay. Last month, we held a hyper-local meeting for our first responders and our behavioral and mental health providers in the area. We had 26 attendees from different police, fire, EMS, hospitals, and our mental and behavioral health providers in the area. Just a explanation of the Regional Advisory Committee, which we refer to as the RAC. It's Pre-Existing EMS Medical Directors Committee under the IDPH, 11 different EMS regions. Again, we're Region 2 that are in charge with the development of regional best practices and protocols consistent with the realities of locale. The RACs consist of several different appointments. I represent a 911 PSAP, and then Megan represents the mental and behavioral health providers.
There's the acronym at the bottom too. So.
Yeah. So, go ahead. Yeah. So CESA stands for Community Emergency Services and Support Act. It is a newer legislation that started back in 2020 or 2021.
Yeah, right around there.
And it's requiring emergency response operators, such as our dispatchers in our 911 centers, to refer calls seeking mental and behavioral health support to a new service that can dispatch a team of mental health professionals instead of police. This is going to be a significant change in the current policies. The implementation details for this new law have been tasked to the Secretary of the Department of Human Services, who work in concert with the 911 administrator at the state police, EMS administrators, and statewide and regional advisory committees. This collaboration requires us all to work together. Not that we haven't in the past. We're very fortunate in McLean County that we've had a relationship that's been stemming for many years. So we're ahead of the game when it comes to this, but we brought everyone together at the hyper-local meeting just to kind of get everyone together that hadn't met and go over the services and the new legislation that what's going to be required of our first responders.
Since it kept getting pushed back, what we found is that some people might have heard of it, but then since nothing happened for a couple years, people kind of forgot about it or weren't really sure what it would mean and when it would go into effect. So it's supposed to be going into effect by July of this next year, which we'll get to, but it was good to bring people together so that they could at least ask some questions or at least be reminded that this is still here and we're still working on it.
So what this is going to mean for our providers. Currently, as we were talking about, this started with a date of July 1st of 2023. That was then postponed until July 1st of 2024, and now is currently July 1st of 2025. During that time, the legislation is requiring public safety access points to coordinate with mobile crisis response teams, which we have been doing to an extent through our 590 providers. community-based response to low-level and low-risk behavioral health crisis. So they have what's called a risk matrix developed with 4 different levels that low level, low risk to high risk. So nonviolent, not showing, exhibiting symptoms of any violence towards anyone else, talks of self-harm, up to threatening self-harm, threatening others, and how they want that to look like, the responses to look like. Those are available on the IDPH website. It's an ever-evolving document that's constantly changing. That is part of the job of the RACs, is to kind of go over those and see, are those things that can be accomplished and how we can accomplish that for our areas. This is a legislation for the state of Illinois, but it's not one size fits all. Every region and the counties within those regions are they vastly differ in size and capabilities as far as response and mobile response units.
And that was one of the biggest things that we realized when we go to the community meetings, is because there are so many different areas that it covers and everyone does something different. That's when they started kind of switching the goal of what we were moving towards, because it seemed like we were spending more time just explaining everybody's area and what everybody did versus really coming up with, what does this mean moving forward and how can we take it to our counties and decide what we want the response to be.
So the coordination is going to be required across 180 PSAPs and dispatch emergency service providers, 68 current mobile crisis team programs, and my mobile crisis response can be dispatched, whether it's 988 or 911 that's called. It's going to require specified training. Currently, it's not mandated. However, again, we're ahead of the game. I know for the 911 side, I've been sending the dispatchers to the CIT courses for 911 personnel and when it's available in the area. And then Megan as well is doing her trainings. It's going to require regional best practices developed by the RAC, consistent with the physical realities of various locations. They're working currently with the protocol providers for 911. We use what's called emergency medical dispatch. So when we get an emergency call for a health call, we have a set of guide cards that we read directly from. We have our TCs have licenses for that and certification. So what they're doing is working with those providers to develop and modify the current protocol and develop a new protocol for first party callers that are in crisis. And also integrating law enforcement into those processes.
So something that has been both a really, really good thing for us, and then one that does have some challenges, is the fact that we have had a mobile crisis team for many, many, many years here in this county. That has not been true for many other counties within the state of Illinois. So a lot of what held this up was the fact that other counties were running into roadblocks in trying to make a 24/7 mobile crisis program. Because in order to make this work, law enforcement and or the dispatchers are going to have to be able to, contact a 590 provider to be able to go out on these calls. And so luckily we've already had a mobile crisis team established and have worked through a lot of the kinks that other places are really struggling with. For example, 24/7 coverage, how many staff should you have on, and different things like that. One of the difficulties is the state of Illinois wanted to put this into effect, but then ended up not necessarily funding it to the amount that you would want probably for a response. In our area, luckily, we are all of McLean County, so we're the one provider that does that. Some areas, they have one provider for like 6 counties. So that can be very tricky when you have multiple counties and it takes a long time to get there. But with our county, part of the problem is we're an extremely large county. So just to try to get there in some of the timeframes that we need to get there, it's not realistic based on the staffing that we have and things. So it has created some difficulties that way. The other issue is because we have been established, we've been very much established in our community for many different things. So for example, we provide services all throughout the county, but also in our area hospitals, which I would say post-COVID, many people, have been showing up at emergency rooms or hospitals to seek behavioral health care versus actually calling us out in the community. So that has caused a huge uptick in are needing to be in multiple different places. So what we've been trying to do is, ever since, for the 2 years, I have been contacting our area hospitals and anybody who would be affected by our response times when this goes into effect, and let them know this is all going to happen. Not that we are, happy of people having to wait longer, but to at least let them be aware that this was coming, and that they would need to realize that we are a mobile crisis team that has to cover many, many different things. We also, in a nationwide hiring shortage, have been trying to work on being able to hire enough people to actually respond to some of these calls. Crisis is definitely a much more stressful position than most, and what we found is many people were not necessarily gravitating towards those stressful positions, especially after kind of COVID and things. So luckily, as I said, knock on wood, I'm almost fully staffed at this point for however long that's going to be. But we've been working on training, recruiting, and then adding different types of training in, because a lot of the staff we have not been with us all that long, so they don't remember previous to COVID when we would go out quite often with law enforcement or go out to people's homes and those type of things. So we are trying to train more on them being prepared to do that. So it's been trying to take the new requirements that we have in this legislation and then mix it in with what we already do for our county, and trying to figure out how we can best utilize the staff that we have to try to give at least a response that we hope will be as best as we can do based on what we're funded for. So yeah.
Real quick, I won't read the entire legislative intent, but highlighted in red. It's necessary and in the public interest to provide emergency response with or without medical transportation to individuals requiring mental health or behavioral health services in a manner that is substantially equivalent to the response already provided to individuals who require emergency physical health. It's important for our providers too to know that nothing has changed right now. We are still, it's status quo. They're still responding the same way they always have. But that's one of the reasons we held the hyperlocal meeting with our responders, was to let them know that, but that things are going to be coming. So they're going to want to start reviewing their policies on the wait times and the standby times, staging times, things like that. There's a few prohibitions that go along with this. Law enforcement responsibility for providing mental and behavioral health care. In any area where mobile mental health relief providers are available for dispatch, law enforcement shall not be dispatched to respond to an individual requiring mental or behavioral health care unless that individual is, 1, involved in a suspected violation of the criminal laws of this state, or 2, presents a threat of physical injury or to self or others. And that goes right along with that risk matrix. Mobile mental health relief providers are not considered available for dispatch under the section if 988 reports that it cannot dispatch appropriate services within the maximum response times established by the regional area advisory committees. And again, those vary depending on which level of the risk matrix they fall into.
Right now, they're broken up into 30 and 60 minutes, and so that has been something that has been quite a debate, because like I said, for areas in which they're doing multiple counties, there's no way they can get anywhere even in an hour, let alone get there in 30 minutes. And so there's been some discussion back and forth on what that looks like and how much this is really going to affect things if we have to constantly say no, that we can't be there for a response. We want to make sure that we try to do those things, but that's why those timeframes have really been important, and we've kind of gone back and forth with that, because trying to find out what will be doable by the mobile crisis providers.
We did have representation from 988 and PATH at our meeting, and we had some good conversations with them, as well as what we could do at dispatch in order to maybe ask a few more questions and triage those calls a little bit more so that we can transfer some more of that call load over to 988, because not everything requires a mobile response. Not everything requires a law enforcement or EMS response. Some of them just need somebody to talk to. So we've been working closely with them. Actually, as more recently as today, I was happy to see that I got an email from a fire chief that's having an open house and invited 988 and PATH and Crisis to come out there and share. It's a lot about public education too, and letting people know what's available out there. Another prohibition to this legislation is that law enforcement shall not be used to provide transportation to access mental or behavioral health care or travel between mental or behavioral health care providers. It's not unheard of currently that if they do have someone in crisis at a call that wasn't really wanting to go on an ambulance transport, that our officers were kind enough to transport them in their squad cars. So that's not gonna be allowed under the new legislation. And then conditions for our our 911 centers is that each 911 PSAP and emergency service dispatch through a 911 PSAP must begin coordinating its activities with mobile mental and behavioral health services established by the Division of Mental Health once all three of the following conditions are met, but no later than July 1st, which again, we've already started these, so we're ahead of the game. Statewide committee has negotiated useful protocol and 911 operator script adjustments with the contracted services providing these tools to 911 PSAPs operating in Illinois. The thing about 911 centers in Illinois is not all of us use the same protocol providers. Majority use what's called either PowerPhone or Priority Dispatch. McLean County, we use at Bloomington and at Metcom, we use Priority Dispatch. So they're working with them to get those modified and add new ones. The appropriate regional advisory committee has completed design of the specific 911 PSAP's process for coordinating activities with the mobile mental health and behavioral health service, which we're doing by sharing this information with all of you and having our meetings as well. And Megan and I talk regularly about things that we can do. Mobile mental and behavioral health service is available in their jurisdiction, which again, it has been for many years. So we're in a good place in McLean County as far as the legislation goes.
And they're working right now, right? PowerPhone has been the one that has contracted the first with the state, so they're running,
Beta testing.
yeah, thank you, beta testing for 6 months currently right now, but our area doesn't have that one. But I do know our area is basically saying, look, we already have all these things in play, so they're working very quickly with Priority Dispatch to try to get another test to be done in our area, so we can at least try to get some data as well to go with everybody else's data because of the fact that we already have so much established. So that'll be kind of nice if we get to be a part of some of those testing, things as well.
And that is our presentation for you all today. If anybody has any questions, we'd be
questions?
happy to answer them.
Questions from the committee?
So of the three criteria that you mentioned that have to be in place before this is implemented, is this we as a county have to achieve these three criteria, or
question.
statewide it has to be?
It's gonna be statewide.
Okay.
And that's why I said that's what they're having a hard time, right? Because at first they put out this legislation for the entire state and then they slowly realized that this isn't a one-size-fits-all deal. So they've gone down to the regional area committees, which focus on their regions. But then we had to go even smaller and focus even more. And that's why they're calling them re-envisioning meetings at the state level. But that's why they advised us to start holding hyper-local meetings to see what we are capable of doing and then being able to go back and share what we're doing as a county. So Megan and I, the next time we have a RAC meeting, which is supposed to be in September, and on that call, we'll be able to share. We will be the second one in our region to hold one of these meetings.
And then the hope is we want to get people back for another hyper-local meeting because they wanted to start diving into how does this affect us? How can we start implementing things that we said we gotta wait because some of the guidelines are still gonna come down from the state and we don't wanna start something and then end up having to find out we have to do something different. But because it has to be the whole state being ready, that's why there's concern that if some places that still don't have certain things established or places where like Chicago's very different than we would be, necessarily. So if they're not ready but we are, that's gonna have some issues for sure. So that's why they're really pushing us. I said in the last meeting we shared, I know from the 590 perspective, we just got a bunch of new outcomes that they were really pushing us on to data collect, which luckily we thought ahead in our county and we've been collecting data for many years, and so we're ready for every single thing that they've been asking of us, but that's thrown a lot of other people for a loop because they don't have a way to collect that same kind of data. So response times, how fast you get to somebody, are you face-to-face with somebody, are you not, different things like that. So people are trying to play catch up with that, but they're giving us very strict guidelines. We have some stuff that's due October, some stuff November, so obviously they're very focused on getting this done, especially from the mobile crisis provider side.
Sure. So you don't see any scenario if we have all of our ducks in a row where the state could tell us, why don't you guys go ahead
No,
and
it's
do
gonna
this?
be,
and-
it'll be an all.
Yeah.
It'll be everybody, so
Alright.
I don't see this being done by July 1st of 2020.
Yeah, most of us think because the fact that they're only doing like the couple pilots, we think that it may be extended again, but
But when it does, McLean County is gonna be ready.
Okay, all right, well, good to know. Thanks for your work on this.
Other questions? Member Hanson?
I just wanted to second everything that he said. Y'all have provided so much information. Thank you for being on top and being ready to go. Kudos to you.
Anyone else? I'll say some of the same things they said on Thursday at, they gave the same presentation to Justice Committee, because obviously we have law enforcement involvement in that too. But like I said, Megan and I have been working on some of this for many years, because McLean County is so progressive in this area of coordination and communication amongst a lot of groups of people. So it's, I mean, it's super, progressive in that area. And then it also fits in, a lot of this actually fits in with the Mental Health Action Plan and the recommendations of the Mental Health Action Plan. So that's how far ahead we are. We had that Mental Health Action Plan long before CESA even was, being talked about. So I think that says a lot for McLean County as to where we're being proactive. And hopefully they'll have us be a pilot for PowerPhone or for Priority Dispatch. Because I've been part of the statewide technology data sharing thing. And so what Megan was saying about being able to collect data, they realized that, yes, there's, a lot of areas that don't have the kind of capabilities that they've had for so many years. So that says a lot for us. I also want to say that this is an unfunded mandate by the state, again. So they also have a legislated group that exists that has to determine how much all of this implementation will cost. And then that's going to be reported to the legislature, because then it's hopefully up to the legislature to create money to pay for some of this. So hopefully that's what's going to happen, because counties throughout the state aren't going to be able to do this on their own without, other kinds of funding. So hopefully information will be out in October. And then the last thing I forgot to ask this on Tuesday, when it said in there that, law enforcement can't transport, eventually, law enforcement can't transport. So how does that affect urgent care or a CSU if we ever get a CSU back again? Because that's the reality, is that it may be, especially in times when you're not able to respond timely enough, or it's a very rural community, and there's someone that needs more care, or even to the ED, is there been talk about that? Because I know that they keep tweaking the legislation and obviously changing the date, but has there been much talk about that in your group of the 590 providers, or even for the PSAPs? Because, there's got to be a response of some kind.
yeah, not specifically a ton on that. I think what it is it's trying to say, because what we're trying to do is be removing law enforcement from going in the first place, they also have to tweak the fact that law enforcement, they don't want us just to call law enforcement to say, hey, we want you to help transport this person. The whole point is to not have law enforcement involved as much as possible. Most 590 providers, they have broached the topic with us of like, do we want to do our own transports? Most areas do not do that. They will have EMS transport or someone else transport. So at this point, they've said multiple different things to kind of try to say, what are some other options you can do for someone? Right now, currently, like if we're talking about behavioral health urgent care, or just really anything, like if we go out to see somebody in the community and we can figure out a transport that doesn't have to utilize EMS and or police, transporting the individual, so a family member can take them, they can, we can figure out some other option for them. Sometimes they live close enough, it's walking, or things like that. Then we work to do that. And so I think that's what they're really focused on in some areas. Or a lot of people's insurance now do transports. So we can set up Ubers through their healthcare. So we can do that fairly quickly. And that is other options, for people. So it is pushing us to try to figure out how to do a transport when we're trying not to have that police involvement. So I think that's why they kind of added that part in there, was just to clarify with law enforcement that we're not saying that they need to be utilized for any kind of transport in that way. There needs to be something else that we try in order to get somebody to the place that we feel like they need to be. So whether that is urgent care or, like you said, like a place to go, a stabilization unit or something like that.
Okay, thank you. Any other questions from the committee? Okay, thank you very much. Great presentation again. Thank you. Moving on, we have other business communication. Our next meeting is September 5th. Anybody have anything else they'd like to say? With that, then we are adjourned. Thank you all.